we really sort of started talking about this a little bit. Anatomy, does it matter? Well, yes, it does. Because if you think about injuries on the ulnar side, so particularly your anterior portions of the ulnar collateral ligament, which would origin and finish where you can see that purple components there, which actually is where you've got your pronator teres. So you're thinking about it, you've got your anterior portions being your medial epicondyle and then going into your coronoid process. So if you've got an injury to the ligament, if you've lost stability from that injury, so it could be mechanical stability from the fibers being torn, and also somehow the input, the information coming is not the best, and you've lost some of that sensory information. So what can happen sometimes is that a muscle like the pronator teres is trying to overwork, is trying to create more stability. And sometimes what can be presented to you is not a hypermobile elbow or somebody that can hyperextend. It's usually somebody that has a stiff elbow. And a lot of times that they've got an inability to supinate. Why? Because pronator teres could be really working hard, especially in these overhead athletes, trying athletes, combat athletes. So thinking about how we can use this knowledge in clinical practice. Well, how? You can test, and we'll show this in a bit too. You can test your pronation and supination, and you can do it in a more bent position where the ligament is not being stretched or affected as much. See if there's any difference. And then when you go into more extension, does that make a difference? And so if there's no difference in a bent elbow and there's a difference in a straight elbow, well, it's telling you that there is a strength component potentially. It's a capacity element. Obviously, we're talking in absence of pain. And so we need to try and address it, because that could be the difference between those recurrent elbows, those chronic elbows. We're not talking in the immediate and the acute, although again, the immediate acute, it could be something to consider around rehabilitation.